All right, good afternoon, everyone. I think we're about 1 minute out. My name's Miss Cook. I am the Chief of Communications here, and we welcome you today. Mr. Menser will provide some operational highlights at the beginning, but just a few housekeeping items for everyone that's in the room with us today. There are restrooms in the back and behind us for situational awareness. In addition to that, we ask that you please avoid sharing any personal health information. This is a public forum and it will end up on our Facebook page. We do our best to edit out anything that's pertinent to your medical history, but please, when you're asking questions during your Q&A, if you could avoid those specific things, we'd greatly appreciate it. And again, welcome, and we're going to go ahead and get started. For our presenters, just situationally, the camera is on this side of the aisle, so if you are waiting off in the wings until your turn, this aisle might be best for you instead of over here. All right, without further ado, I'd like to introduce our Executive Director, Mr. Kai Menser. He's been with us since June of 2024.
Thanks, Chanel. Thank you. That rarely happens. Thanks for having me. We're glad to, I'll get out of the way of that. I'm a walker and a talker. Thanks for allowing us to come to your clinic. We're trying to do these on the road so that it's a little bit simpler. I was just telling my team, my departure home will be 2.5 hours tonight with the traffic, so I'd much rather come to you than have you come to us inside the perimeter, as I've learned. We've got, so to talk about Chanel's comments about sharing specifics, share enough that we can help, but not too much that people online can steal your identity. Because that's a real concern, okay? We've said that a number of times, and people get up and they say their last name and their last four, and then they get into their specifics, and then next thing you know, there's possibilities for that. We also have experts in the room that can speak to you specifically about your case, your challenge, or your compliment, if that's what you've got. And in the back of the room, you guys, if you've had any time here, you'll see all those different tables with those experts that can help. So the first thing I want to do is address, last week we had a tragic event occur in our healthcare system. So we have 19 clinics and 3 medical centers. So this is one of our larger clinics, believe it or not. We don't consider this a medical center. And one of our smaller ones where we have about 2,500 patients, we had a veteran in a mental health crisis come in and shoot one of our employees. Yeah. So I'm sharing because what you're going to see is a little bit more of a heightened awareness for safety and security at our 19 clinics and 3 medical centers. That might include a police officer, it might include magnetometers. What we've learned since is that in some of the communities, it's pretty normal to carry around a weapon and bring it with you everywhere you go. Now, I know we have signs everywhere, and there can be sign fatigue where we might not pay attention, but our staff are now being encouraged that if you come in with a weapon to require that you put it in your vehicle and then report you. And that's out of an abundance of caution, and it's the law for us in our healthcare systems. So what you see on the slide is that that clinic is still closed. We're working through, there's about 31 staff members that were in the clinic or impacted. That employee is no longer with us, and we have done everything we can to support his wife that was 8 months pregnant and their 2 children, yes. And the staff, we're trying to figure out how do we best serve them after living through this environment with a close colleague that they're very good friends with, and are taking steps to improve security and safety everywhere throughout our healthcare system. Our new Chief of Community Care. Thank you. I saw someone taking a picture, it threw me off, and I was like, I wonder why. We have a new Acting Chief of Community Care, Mr. Fred Brevard. So just a couple of weeks ago, he started as the Acting Chief of Community Care. So if you've got any questions, comments, concerns, thanks for taking pictures. That's why I asked if we'd put his contact information in there so you guys can email him directly and talk about what you've got going on. We've got a really cool system in our community care program. It's called EPS. It's called External Provider Scheduling. What it means to you as a veteran is that it reduces the phone calls you'll get to schedule an appointment. So if somebody gets a hold of you and it's for something like dental, they can schedule you on that call in the community. There's no more back and forth of waiting with the community and then waiting for us and then waiting for the community. And we're trying to get more and more providers signed up for that, like Emory and Wellstar and Northside and all the big healthcare systems. All right, next, we have a new acting chief of police. He's not in the room. I'm looking at no, he's not, no. Mr. Crawford, so he started Monday. We've had an acting chief for about 2 years in our healthcare system, so we're shaking up some of the police service responsibilities. Mr. Crawford comes from the New Jersey VA. He's been around for a while. You can see he was at the World Trade Center as a responder during 9/11. He's been in law enforcement for more than 32 years. Thanks. And then I think this is my last one. I have 2 more after this one. Dr. Feldman is our new dermatology chief. Here in the healthcare system, I wanted you guys to know that. We've got a lot of veterans that use his talent, and he's done a great job for us. He also serves as the chair of research for dermatology. 1 more, 2 more. This is a really nice, positive story. We're now using live caption glasses with our veterans, right? So this technology exists, and we have it as a resource to help support you. In February, we're the first ones to ever use this. It's called a Xander glass, and it helps communicate with our veterans. So if you're interested in doing something like that, work with our teams on, it's a hands-free device that allows you to read the conversation in real time. So, right, if there's some audiology challenges, you can see the words on your glasses. All right, and one last spotlight this week. Members of my team, my nurse exec is here, and my chief of staff is here. And they went over to Emory, and we are the first VA in the country to partner with an affiliate on a doctorate program in our nursing service. So there's lots of affiliations across the country, but that next level of education and responsibility and learning, we were the first ones in the country to partner with Morehouse on that affiliation. Now I think that's it. All right, so this is Amy Whitaker. She's our Chief Experience Officer. She's been with us since October. She reminded me that after a couple of months of me pushing really hard. She said, "You don't even know who these people are yet. Give me some time." So I'll turn it over to Amy to talk about some of the updates for experience.
So good afternoon. Thanks for having us. I'm going to be really quick, but I cannot be with the microphone and a slide deck and not tell you the great things that we are doing to improve your experience with us at the Atlanta VA. It's really, really important to us that you have a positive experience, and that's my entire purpose of my job, and so I'm working hard on it. One of the things I want to share with you is our inpatient. So if you come to our hospital, we are doing everything we can to make that experience better for you. You are in the hospital, right? But we want it to be a compassionate, quality-driven experience. And recently, our inpatient hospital was named one of the top most improved hospitals. And so that's fantastic when it comes to patient satisfaction. So we really are focusing on making your experience better. Some of this data gets really delayed. So the most recent data we have is from December, and it was the highest patient satisfaction in our hospital since November 2024. And so we're really, really proud that we're doing a lot of things to make that better for you. In outpatient, so do you trust us to provide your health care? We are in 5-month improvement streak. So again, we're getting better and better and better. Our current trust score with veterans in Atlanta is 87%. We are gonna get to 90, you just mark my words. We're doing a lot of things to make that better, really engaging with stakeholders out in the community. The folks that you talk to, the organizations that you work with are really a great way to share with us what's going on out there so that we can make that better for you. We're doing that. We're working on restfulness of hospital environment, which I think you're gonna hear about. We're really focusing on answering questions timely, getting you an answer to what you need really, really quickly. My ask is, if you get a survey, please fill it out. I know it can be tedious. I myself don't love doing it. I do them now, I promise. But we make decisions based on that feedback. And if we only have a small percentage of veterans telling us what they think and we make decisions on that, that may not represent you well. So if you get a survey, you might get one in email, you might get one in mail. We really would love it if you would fill it out for us. So thanks for having us.
Hey everyone, it's an honor to be here. My name is Amit Shah, and I'm one of the preventive cardiologists at the Atlanta VA. And I'm excited to tell you about our program in home-based cardiac rehabilitation. So this is a program that the VA has innovated actually on a national level, a way to help veterans virtually, specifically thinking about the rural veteran in mind. And cardiac rehab is a program where when a veteran has a heart attack, they're invited to exercise at a hospital 3 times a week for 12 weeks. And as you can imagine, that may not be feasible for a lot of veterans, especially if there's no nearby hospital or if their work schedule does not allow them to go to a place 3 times a week for 12 weeks. So we have a virtual program at the Atlanta VA that actually does just as well as center-based programs where instead of exercising at a hospital, the veteran exercises at home, but under the guidance of a coach that they meet with virtually once per week. And it's amazing what can happen with small habit changes to help someone get to where they need to be in terms of wellness. We take some of the we invite some of the highest risk veterans who are invited by their provider after being hospitalized to come to us, and we work with them one-on-one on a holistic plan that includes not just exercises, but stress management and nutrition. And what's different about our program is that we also work with technology. Now, that may be harder for some than others, but we offer a lot of TLC to make that technology actually useful and not intimidating. So we understand what role technology can play when it backfires. We were recently featured in the VA News, and here we are with one of our veterans that's really taken off with the program, and Shaquana Jones, our kinesiotherapist, who works very closely with the veterans and offers a lot of really, really high-touch care. Next slide. So the other thing that we do is we collaborate with other VA services, including whole health psychology, and also dietary services. And as we discussed, not only do we do one-on-one calls, but we also have group classes. So yoga and Tai Chi are some of the group classes that we offer. What we found is over the years, we've served over 1,000 veterans. Veterans actually have half the risk of dying when they do programs like ours compared to where those who don't do the program for other reasons. Controlling for all other ways that may make them different. It was pretty profound, and I think that part of what it shows is, wow, exercise is a medicine. This is like a drug, but it's also fruits and vegetables, things like that. Those are medicine equivalents, and that's part of what we try in our program to instill. And we've been able to also work with other VAs to get their program started, and there's a VA program called Shark Tank that we were able to take a part of as well, and we won some awards there. So anyway, thank you for your time, and I'll pass it on to the next speaker.
Wait a minute. You got to go back. Yeah. Can you go over that one more time for us? Just this part right here, 50%.
Yes.
Is a high number for me as a veteran.
Absolutely. So it's pretty incredible that we were able to find that. And I almost didn't believe the numbers when I saw it. But what we did was we looked at the people that were referred for cardiac rehab, but for some reason were not able to get in, and the people that did our program. And it was pretty amazing. And you're like, well, yeah, but those people are different. We statistically adjusted for all the differences. They actually aren't that different. And we found that, in fact, the rate of death was in half. It's pretty incredible.
So you're better off coming to get your services by way of death if you don't.
I mean, it's a very tough reality to deal with that, if you don't engage in these programs on getting at, like, why did the heart attack happen in the first place, right? Because ultimately what we're asking is, what just happened there to cause heart disease? Let's try to undo that. And I think that is a very important step that it's really hard to do in a very fast patient visit. When we spend an hour per week with someone for 12 weeks, we can get at those reasons.
So if you're having cardiac challenges and you're saying to yourself, no, I'll be all right, I would encourage otherwise, right? Because we want you to be around for Christmas, to see your loved ones, and to grow up with your family. So please, please, please take that seriously, and I encourage your attendance. Thanks. We don't have Dr. Fong here? All right, let me see what I can do. Dental access update. What the data shows. We've had a significant increase in veterans that are eligible for dental. And right, I know this as a veteran, rarely are you eligible unless you're 100% service connected. And what's happened is through the Mission Act and other areas, we've had more veterans become 100% service connected. We have a 44% decrease in staff and are working to fill them. It is even harder down here. How many of you get your care in Dublin? No? Dublin, down in Dublin. No? So I know because the Dublin director cannot hire dentists in this region. So it's even more difficult down here to find community care providers for you as veterans. The good news is that's the #1 used electronic service for us in scheduling in community care. So if you have a dental need, it is much faster than it used to be through our community care department, and we're scheduling really, really quickly for our dental veterans. We have a pilot program to separate new patient exams from treatment clinics to help balance the complete veteran. I don't know what that means. I wish I did for you guys. I'm sorry, I'm not the dentist. We're trying to work outside normal tours of duty, so we're trying to extend our dental hygienist time, just spread them a little bit outside of the normal 8 to 4:30 hours to provide some support. And we're partnering with schools. In the fall, we're going to start training some of these folks so that we can hire them directly. And we're growing staff at Fort McPherson by adding 2 dentists. So that's probably one of the closer ones and driving inside the perimeter. If you have any questions about dental, probably don't ask me right now. But we'll follow up with somebody who can support you on that one. Okay. All right. I'll turn it over to our women's veterans.
Good afternoon. I'm Kathleen O'Laughlin, and I'm the Women Veteran Program Manager. I do have a table in the back with lots of information, so please come and see me for resources after this if you would like some. A couple quick updates. We have a woman veteran only town hall. Twice a year we do that, and we really focus deeply on gender specific care needs of our women veterans. So it'll be April 16th at the AVC Clinic at Arcadia, and we'll have an info fair preceding it, and the town hall will be from 2 to 3, and it's also going to be virtual if you can't make it in person, so please try to come. We also have started a monthly meetup face-to-face, and it's at Post 66 at the American Legion in Avondale. And it's for our women veterans to come to get important healthcare information. It's a 2-hour event, the 4th Wednesday of every month, and the health topic changes. So we really encourage women veterans who can travel to that to come and connect with us. And we also do quarterly focus groups. We really want to hear from our women veterans about what's important to them. So here's some information. My contact information is here, and I also have a table in the back. So please come see me.
Greetings, everyone. I'm Dr. McGriff Young, and I am the coordinator for the Community Nursing Home Program. This program has been around since 1965. We provide care to veterans in the community. If you're 70% service connected, if you're at least 60% service connected and unemployable, 70% to 100%, or you have a service connected condition that requires you to be in a nursing home, the VA will cover it. You just have to be willing to go to one of our contracted facilities. And so we provide these 4 levels of care at our contract facilities: short-term, long-term, respite. For respite, you get either 2 15-day stays per year or 1 30-day stay per year. And hospice care, if you go under hospice care, you have to remain on hospice the entire stay for VA to cover. At this time, these are our nursing homes that are accepting. If you have any questions and concerns, are the numbers at the bottom, and also have a table in the back.
Hey, good afternoon. So as I'm walking up here, somebody's like, get one of these for your foot. So I wanted to introduce, we do a 3D printing in prosthetics. So you're like, okay, cool, whatever. What does that mean? So let's go to the next slide. And I know y'all were seeing the video earlier. So this is the cool looking cast. I'm not encouraging anybody to break anything in order to receive one. However, if you do, this is waterproof. It allows for better healing. It looks pretty cool. We've got different colors and different styles, and it just is a better motion for you. Let's go to the next thing. This is the thing that I think is super cool. The casts are cool too, but we can print. So the sockets to check and see if the prosthetic limb fits correctly, we can print those in 2 hours. Anybody who's ever experienced something like this or has had a family member or a friend, it normally takes days or weeks. I got a wow. I like the wow. The actual definitive socket that the prosthetic goes into, 6 to 8 hours. That's hours. That's not days, that's not weeks, that's not months, that's hours. Again, many different designs, it's sturdy, and so this is something that we're looking to, next slide, thanks. Oh, back to that, I might do this one anyway. But that's something we're looking to expand and grow throughout our catchment area, but actually incorporate with maybe other VA facilities to help our veterans out. It makes the process better, it's veteran-centric, it's better for you, it's better for everyone. So that's the scoop with the prosthetic printing. And I'm gonna talk for my chief of engineering because he is stuck in traffic, and I told him to stop texting and telling me that he's in traffic and just drive and pay attention, but he's not driving a government car, so that's the good thing. We're doing a lot of projects, and I know it doesn't seem like that because you don't see hammers, nails, and people pounding in walls on our campus. But this is what's going on our 5th floor. 35% design means pretty much what it says. It's been designed. Once it gets to 100% design, then it goes to a build, and so we're moving along with the 5th floor. Our cath lab, so it says estimated construction period 396 days, so it's gonna take about a year, excuse me, to build it and get it where we need it to be. But once we get there, that's gonna be a great advantage for the veterans, for our clinicians, they can diagnose better. It'll just be a great opportunity for everyone. Next slide, please. So Trinket Davis Veteran Village, we just heard a talk about community nursing home. This is one of our VA nursing homes. Same requirements are in place as far as the service connection, but we're adding more. The completion date for that project is 31st of September in 2027. It's moving along, it's moving in the state as it should be. We're not running into any barriers. And it's gonna make the nursing home more acceptable and we can accept more veterans, and it's VA care, which in my personal opinion is the best. This is just kind of a description, kind of like pictures of what it looks like. It's VA nursing homes, CLCs are more of a home-like environment. And that's what we want because at the end of the day, that is the veteran's home while they're there. Elevators. Nobody really likes to look at elevators. They're boring, but they take you from point A to point B, and they have to be safe. Nobody wants to get stuck in an elevator or have an issue. They're a big deal to fix and replace, and so we're doing this whole entire project. We're moving through it. As you can see, it's about a $6 million project to replace all the elevators and make sure they're safe for you and your family and our staff, so that's where we're at with that. Next one. See, I talk way faster than him. I'm not Mr. Minley, I'm much shorter, but I'll give it over to Dr. Lee.
Thank you. Good afternoon, everyone. I'm Dr. Lee, covering for Fred Brevard, who is our new interim Chief of Community Care. I know Mr. Mincer has already pretty much given away my presentation, but I do have a little bit of information to share with you. So again, external provider scheduling is a way for the VA to schedule you a lot easier. Previously, we would have to call you, then call the doctor, then call you back, and then call the doctor back, and then back and forth. This is a lot quicker. We can actually schedule into the provider system instantaneously while we're working with you on the phone. So it helps speed up the appointment, it gives you more choices, less delay, and better coordination. The other thing is, if you have a provider that is not in EPS, but you would like for them to be, and they're interested in being in EPS, you can let community care know, and they can try to work with our Optum in order to get them a part of our contract so that we can use this service to schedule you going forward. Next slide. So I don't want to bore you with data, but I do want to share with you that it used to take an average of 107 days from your scheduled date to your actual appointment using that old method. With EPS, we're down to 17 days to get you scheduled and get you to your appointment. That is a huge difference, okay? And so we want to continue to use this. We're trying to get more people, more providers in EPS so that we can get you better service, better appointments a lot quicker. The other thing that I want to note is we used to not be able to do same day or next day appointments. We're at least at 4% using EPS. Now, you may say that's not much, but it's something. So that is where we're trying to go. As we get more providers, as we get more scheduling opportunities, we might be able to get to a point where we can do more same day and next day availability. And a lot of that 4% comes from dental, as Mr. Minter had already mentioned. Next slide. So last but not least, what to expect? Sooner appointments, more options. We're actually coordinating with our business office, who normally only schedules your internal appointments, so appointments here with the VA. We're coordinating with them and our providers and our staff to be able to also schedule you in EPS. So you might actually go see your doctor, and your doctor may say, hey, are you available on this day for community care? Because I'm putting you in for that consult, and they may be able to schedule you as well. So we're looking to be able to schedule you across all of VA in care coordination. Now, that requires training and developing for everybody. So it's going to take a little bit of time, but we started in dental. It was very successful. As you can see, same days at 4%. That's better than before. And so in the future, we're hoping that when you come to the VA, no matter which way you come in, you leave with an appointment. So if you have any feedback, if you have any delays or any issues, please let us know. We do want your feedback. We do want to hear from you. Mr. Brevard's information was provided, and we do have a table in the back. So again, thank you for being here, and we look forward to seeing you at more appointments.
So I just wanted to give you a briefing on our onboarding status. I know there have been several articles talking about we've not grown and we're not growing with our staffing, but this is actually showing you the exact opposite. So if you can see, we actually have increased by 414 staff members, and that's clinicians, that's everybody. That's not just the clinicians. It includes housekeepers, it includes all of our disciplines. So it's not just physicians, it's everyone. So we have a net gain of net change of 414, as you can see.
So if you add these three gains minus these three losses, you'll get 414.
Okay.
Here's the point. We are hiring.
Yeah, that's the point.
We're not hiring fast enough, and we need to hire more. That's the absolute truth, because we're growing by about 500, 600, 700 new veterans every month in our healthcare system. So I don't know what we're doing here in Georgia, but people love to move here, and our veterans they're no different. They're moving here as well. So we're trying to keep up with the number of staff we hire in comparison to the number of customers, veterans that we're enrolling every month.
And we're number 3 in growth.
We're number 1 in the country by number of enrollees. There's about 190,000 veterans enrolled in our healthcare system, which is the largest healthcare system in the country. Gainesville, right down the road from us here, Gainesville, Florida, and Dallas, Texas are the other two. We kind of bounce around in the top 2 or 3 every time we get these reports.
Yeah. So the bottom line is that we're big, we're growing, but we are also hiring, but we're not hiring quick enough for the amount of growth that we have here in Atlanta. Oh, and that's my only slide. Okay.
About 28% of our staff are veterans the last time I looked. Yes, sir. Yeah, and we want to hire more. Awesome. I love it.
Hi, good afternoon. I'm Jamarca Minora. I'm the Assistant Medical Center Director, and I'm a veteran. So I answered your question.
Or veteran?
Veteran.
We had this talk last week, right? There's veterans and there's veterans. And those that are, yeah, see, y'all know.
So Ms. Tiffany Taylor, who's the Chief of Nutrition and Food Service, could not be here today, but just want to talk quickly about the layout of Nutrition and Food Service. So obviously provides medical nutrition to veterans who receive care at the hospitals. There's about 28 clinical dietitians across 29 sites of care. They offer in-person, virtual, and telephone appointments. They also have the Move Weight Management Program, which offers the same services. And for My Healthy Vet, just ask a dietitian for any, you can use My Healthy Vet to ask a dietitian for any nutrition-related information. Next slide. And for National Nutrition Month, we celebrated at the main campus. We've popped popcorn for the veterans, passed out educational information, as well as veterans learn about how to eat healthier snacks and have a healthier nutrition. And if you have any questions in the back, we have Heather back there, one of our newest dietitians. You can raise your hand. Yep. And this is her first week. So, all right, thank you guys.
Good afternoon, everyone. I am Tasha Walker. I'm the chief nurse of acute care. What that means is I oversee all the inpatient beds, and that includes MICU and SICU. So I'm going to pivot off of Ms. Whitaker, because one of the patient satisfaction that affects the organization is restfulness. So with acute care, we have worked diligently to change how we perceive rest and healing in the hospital for the veterans, and to ensure that we have peak times during the daytime, and then there's allocated time so you can rest at night. Next slide. What is restfulness? It's a protective time where noise, light, and interruptions are minimized to support patient rest and healing. Why restfulness matters. It contributes to your healing and recovery. It reduces stress. It facilitates your pain control. And it also enhances the patient satisfaction in telling us how we are doing in the facility in regards to your care. How are we doing? So as you see, the numbers are very all over the place, inconsistent. But what that tells us at VA, we have work to do. So what that means is we look at these numbers every month, and we are going to find strategies and implement strategies to reduce the noise within the facility, and help your stay in the organization comfortable, but also ensuring that you get the quality care that you deserve. So how are we doing this? So the first thing that we're doing the Jacker trackers. So this is going to help the staff stay aware of noise levels in real time. And we're going to we have already reduced the intercom volume and limited announcements, especially during the quiet times. So we have an allocated time between 2 and 4 p.m. every day, and at night we have limits the noise or interruptions or announcements between 10 and 7 a.m. And this is to decrease unnecessary disruption. Admission kits. When you're going to be admitted to the hospital, we arrange an awesome admission kit, including eye shields, earbuds, and comfortable items to support your rest. Each day, you have a daily 10 a.m. survey. And so what this survey tells me and my managers of each unit is how well you rest the previous 24 hours before. So what this means that we will come and do an instant service recovery to find out what we did wrong. And by us doing this, when you get your surveys in the mail, you can, you won't have that negative impact because we've already corrected it prior to you leaving. We also wireless audio connection options for the TV. And so this is essential because you may have, some of our rooms are cohort in terms of having double occupancy. So if I'm admitted with Ms. Cook wants to stay up all night at 2 a.m., she can. And so I will be able to get my rest that I deserve. So this is awesome. Restfulness of the hospital environment. So these are the questions that you will be asked when you receive the survey. During this hospital stay, did doctors, nurses, and other hospital staff help you rest and recover? During the hospital stay, how often were you able to get the rest that you needed? And during the hospital stay, how often was the area around your room quiet at night? Our goal is to ensure every veteran's stay is calm, quiet, and respectful. Our goal is to be committed to enhancing the quality care through restfulness. And our goal is to hear from you. Your voice matters. As we want to drive change within the organization. So presentation summary, your restfulness matters. Atlanta VA is committed to decreasing the noise level, and we want to hear from you. So thank you so much for your service, and thank you for allowing me and the rest of everyone else to provide care to you. Thank you.
All right, so we're going to have our VBA. Sorry, Angela, I'm going to cut in for a minute because I like the transition there from we want to hear from you. Let's do some questions. Do you guys have some questions for us? Go ahead, sir. Someone will walk around and not give you a mic. They'll hold it for you. Every time we give someone a mic, they take it forever.
Okay. My problem, sir, is sleep apnea. I'm having problems sleeping at nights. I've been taking a lot of medication.
Okay.
And she's a testament. I just can't sleep. I can't rest. I can't get no sleep at all. But I'm still taking all the medication. What can you guys do to facilitate me? I have a machine that I used to breathe through, so it's not helping. Still not sleeping at all.
So I started in the VA as a housekeeper. So I don't really know how to clinically provide better care for you, but I have some experts that will meet with you momentarily. Okay? Yeah, I love it. It does take a while for our sleep teams right now, but we have 3 initiatives, and one of them is to improve access to the sleep clinics to make it faster for everybody. You know, nationwide, we had this issue with the sleep apnea machines, right? It was recalled everywhere, and we were part of it, but we've figured that out now. And we've noticed that there's a lot of veterans like you with sleep apnea, and there's a lot of needs to get tested for that. And so we're doing, underneath Dr. Lee and Access team, we've increased the number of slots every week, and we're trying to bring veterans in sooner. Yeah. Go ahead, Mr. Kendall.
I have a number of community care issues.
Okay.
One is that the virtual reality things that are available for veterans have to be prescribed by your mental health professional. However, my mental health professional is in community care and cannot write what's needed for me to get that. Same with podiatry. My podiatrist that I get injections and do all of those things cannot write for me to get shoes. So those are problems for me. The other problem that I have, and I moved here from Kansas.
Okay.
I retired from the VA, by the way.
What'd you do?
HR.
Okay. We can use some HR stuff.
I don't want to work again.
She
Thank
said
you.
no. She said no.
But in Kansas, we had criteria that we had to follow. So I don't understand why I never get an answer when I call different departments in the VA. When I finally call patient reps, they say, yeah, we know we have problems with the phones, but that's not helping me any.
Yeah, that doesn't help. And we don't have problems with phones. We have problems with people. So I will own that. Our phones are not broken, but some of our people are. And I need to know who they are so we can help fix them. Genuinely believe that most of our staff come to work to do the right thing, but there's some who don't. So we can work on that. What you're speaking to is what's called a referral for service from the community back to the VA. And we've stood up a group of folks in our community care department to help us do that better. Because we're growing so fast in veterans, we're sending more veterans to our community care department. And that's causing some of these challenges. So Dr. Lee's right. If you're having a challenge, we want you to speak up. Now, let me tell you, though, we look at our telephones every morning to see how quickly we're answering them and what the drop rates are. And we're losing about 25% of our customers on that telephone. So folks call in and they wait too long and then they drop off. Okay. I get my care in this VA, and I know I called and it was 20 minutes before they answered, right? Now I was a veteran, so I'm not a director at that point, but I do keep that in mind when I'm talking to you guys. And I later told the chief of community care, hey, this took too long and this is what it looks like. And we are working to staff that better so that we can answer it more timely. So, but we do need to know, okay?
I've also been waiting for almost a year to get into dental and not to offer community care. And then my last comment is that your nursing home slide said that it was going to open on the 31st of
We'll update that. She said the nursing home's going to open the 31st of September, but there's no 31st of September. Yeah, thanks for that. Right. Are you sure you don't want a job? That's a good eagle eye.
My issue is sort of the same, terrible communication.
Okay.
I have applied in October of last year for a grant to help my husband,
Okay.
who has Parkinson's, to get a shower. And because of that, I've been sent around the world. I've reapplied multiple
Is
times.
that a HISA grant? Like
No, it's SAH or SHA, I'm not sure.
Okay.
But then I found out from SAH calling me the other day that he had to have a rating for it. So I called back our VA provider and she says, we don't rate them for a grant.
Yeah.
So I'm going in circles,
What's
going
an
in circles.
SH? Anyone know on my team?
I have talked, yes, special adapted housing.
Perfect.
And get your information and work with you. The home loan program is situated in our office. I don't have oversight over that, but I know people and I can assist if I can get with you afterwards.
I'll be glad to.
Awesome.
Also,
Same for you.
I receive calls from people at the VA and they leave extensions that are not valid when I call it back.
Can you give me those extensions?
I sure can.
Thank you.
Got one from yesterday.
Thank you. Yeah, I'll call it too.
The guy talks so fast, you try to write it down. That's the guy that we were left.
It's George's his name, so we're good to go on sharing that one. There's a lot of Georges. So I'll find out who that is. Thank you. What's the specialty? Do you know? Okay.
They called his phone. He talked not good. I had
Yeah.
a fence.
That happens in my house too. Thanks.
It's his primary number so that we won't go through me losing these calls because I don't know if it was about the SAH or the SHA. Like I said, I've been trying to get this since October.
We'll find out and fix it. Thanks for coming. All right. Yeah. I'm gonna, okay, where's Angela? Miss Sealant. I'm gonna turn it over to our VBA colleague. It's that building when you drive in on campus, that's right to the right, the Isaacson building. So we'll turn it over to her to talk about some benefits associated stuff.
Right. So good afternoon, everybody. I'm appreciative of the hospital for inviting us over here. Like Mr. Mintzer said, we're the building right next door on the Decatur campus. We are the regional office. Benefits processing is what we do. We rate compensation claims, and we also work veteran readiness and employment claims, helping veterans get a skill set when they're disabled to have meaningful employment. So those are the two primary business lines. But as I was just saying, we have the home loan program also located in the office. They are not within our oversight, but they are there, and we have resources there that I can help get answers to questions for. There's a lot of information on this slide. I'm just going to do the cliff notes for it. Many of you, I'm sure, heard about it. There was an interim rule that was issued on February 17th talking about how we rate disabilities. And that interim rule said that we would look at the condition with medicine taken for it, if that makes sense. So we wouldn't look at the condition without meds. We would look at the condition after the veteran was on medication, and we would rate based on that level of disability. We walked that back pretty quick. If you haven't heard the news, we walked it back, and that's my first slide here because I want everybody to understand that is not going to happen. They stood down on that on February 27th, and they said, we will do things the way we've always done them. We will rate disabilities without meds. So it's the state of the disability without medication. Nothing ever changed. I want to reassure you that during those 10 days, did we change the way we rated claims during those 10 days? We did not. We did not. All the processing stayed the same. We never pivoted to rating a disability as it would look on medication. We never did that. And now that rule is out. They published it in the Federal Register and they rescinded it. So just want to be sure we're clear on that because there's been different news media on that. And I just wanted to just start off with that for you guys. So next slide. All right, so the secretary has put some challenges in place for VBA. One of them is to reduce our claims backlog because who wants to wait a long time for a claim to be worked, right? So 125 days is what we define a backlogged claim as. So if it's less than 125 days, it's not considered backlog. It's got to be over 125 days. So in the past year, looking at the data up here, since January 20th, we had 167,000 or so in our inventory. We reduced that down, we reduced it down from 264,000 to 97,000 as of February 14th of this year. And if you hadn't heard, it's the 250th birthday of America this year, right? And so we have a challenge in-house to try to get that backlog inventory from 97 down to around 64,000, and we're working hard to accomplish that. I have some data up here for Georgia veterans because that's probably what concerns you most. This is statistics on just Georgia veterans, and I would like to say that all Georgia veteran claims are not worked in the Atlanta office. They are worked in many offices. We try to put them in the Atlanta office, but if another office, say, I don't know, Los Angeles has capacity, the claims will be moved there. It's all electronic now, and they move the claims to where there's capacity so that veterans are not waiting as long. So we work a preponderance of Georgia claims, but not all claims. So these claims could have been worked anywhere. Can you go back one more time, Mike? Thanks. So 69,603 disability claims is what we have rated so far for Georgia veterans. That was data as of this week, March 23rd. Our current wait time for Georgia veterans is about 76.7 days for a disability claim. Now, there's exceptions there. If it's military sexual trauma, if it's an appeal, those are going to be much higher wait times. This is your regular claim, not a specialized type claim. It's about 76 days. Currently, there's 3,946 that we have in our that are considered, quote, backlog cases, 125 days or more. That's about 14% of our total inventory. Okay. We are doing a lot with automation, and that scares people because who wants a robot working your claim, right? You want a person working your claim. So I'm here to tell you, just because we use the word automation, this is never going to be automated all the way through from front to end. There's always going to be a person there, okay? So what this does is when a rater gets your claim, they have a lot of evidence to look for. They have to look through service treatment records. They have to look through your medical records. There's a lot of things to look at, right? Before they can even start to make a decision on your claim, they have to gather all the evidence in your file. Well, automation is smart enough now where it can go through and pull all the documents within someone's file that has key buzzwords that we're looking for to rate a specific condition, pull those to the front and help the rater actually rate the case much quicker. So those are things like automation is doing. It's not working the claim all the way. It's just assisting our processors in gathering information so they can make a decision quicker. So these conditions up here, hypertension, migraines, and so on, these have been fully automated to the point where they have been deployed nationwide. So what does that mean to you? If you claim any of these conditions on a claim for increase, what could happen is maybe you have 3 conditions that you claim. If one of these is those 3, you might get a decision on that quicker than the rest of your conditions that you claim because they've been through automation. So you might get a decision on one, and we might have to defer a couple others. So that's how that translates to you. If you have any of these conditions, you might see a decision slightly quicker because they're going through automation. And then there's 25 other conditions they're working on too. So they're adding more conditions every day to the automation. I want to talk a minute about fraud prevention because we see this all the time. You know, people that want to do bad things, they know that sometimes payouts for veterans, we do retroactive awards sometimes, and they create high dollar checks, and people that don't want to be nice, they want to help veterans and they want to take advantage of the money that they're getting, right? So I'm here to tell you, just be careful if you're having somebody look at your claim with you. Next slide. Make sure, I want to talk about VSOs. VSOs, everybody knows who those are, right? Georgia Department of Veterans Services, American Legion, Disabled Vets, those guys will help you free of charge. There is no charge. and they know the system really well. They know it very well. They know it as well as the people that process the claims. They know it well. They're very versed on benefits. They can also file a claim on your behalf, and they also have access to our systems where they can look in our systems and see the status of your claim, just like someone that works at the office. So if you need an advocate, I strongly suggest a VSO because they're free of charge. Next slide talks about accredited representatives. If you want to pay an attorney, please make sure that they're accredited. If they're accredited, they've been through a background check by us. They have access to our resources, and they're good. If you're just getting any attorney and they're not accredited, I would say beware, because we haven't vetted them or anything like that. So be very careful when you have representatives helping you with your claims. Appointments, I know nobody wants to drive up to Decatur, right? If you were in the area, we're open 8 to 4. We suggest appointments. You can do walk-ins, but it's very busy since we're co-located with the hospital, so sometimes it's hard to get in if you're a walk-in. You can visit our website, and we have a phone number there where you can call and get a virtual appointment. So if you don't want to come up and see us, you can just make a virtual appointment. This is different from calling the call center. This is speaking to someone in the regional office, so it's a little bit different service than the call center would provide. And then every month we have a virtual claims clinic. The one for this month is April 23rd. If you go on the website, you can sign up to speak to somebody between 4 and 6. So if you're working during the day and 4 to 6 is a good time to talk to somebody, we will make an appointment and talk to you after hours once a month during this virtual claims clinic. And I'm talking really fast because I know I don't have much time. I think that's it though. I think I'm at the end. Is that it? Yep.
All right, thank you, Ms. Steelhammer. I think that Mr. Menser went outside to connect with a veteran. So at this time, we can go ahead and get the Q&A underway. For those of you who are joining us online, I think I counted possibly 12 or so veterans. I know we have some staff members on there as well listening in. If you have questions, please put those in the chat. For those of you that are in the room, there's a couple of us on our team, myself, Miss Frances Turner, and Mr. Kendall. We all have mics, so we will just follow your hands. Yes, ma'am. Yes, absolutely. So on station, we have folks from, I believe, VEO, Women Veterans Program, mental health, I believe. We have nutrition, social work, Veterans Crisis Line, and I think I missed someone. Gentleman right in the front, sir, with the glasses. Which department are you with? VHRC, so that's the Veterans Resource Hub, I believe. They help with apps and things of that nature. Yes, Dr. Lee. And community care is also here as well. Community care is in the back right. So if you have specific questions that you'd like to ask, you are more than welcome to connect with those SMEs that are in the room. Thank you for that, Ms. Ford. And also we have Ms. Steelhammer from VBA, and I believe some of her colleagues and peers are in the room as well. We mentioned mental health. Thank you so much.
Mental health.
Yes.
Community care is the big one though, and it's first come, first served. I always say that, and then like there's 1 or 2 veterans that are like, okay, and that's where they go. What other questions? Sorry, one of the veterans and his spouse was heading out to go pick up their kid, and I wanted to make sure that I could address anything they had. Any other questions from y'all? I'll hold mine for you.
Another question for how often do you have those virtual, how can I find the dates?
Go to our website and we have them on there.
The VA.gov?
They can help you afterwards at the table, but.
VA.gov is the website for the.
So the question was, how often do we have a virtual claims clinic where you can call and talk to our reps from 4 to 6? We have them once a month and we advertise them on our website, which is up there, the www.benefits.va.gov/Atlanta. And the one scheduled for April, they're usually around the 3rd week of the month, is the 23rd of this month.
I saw 2 other, go ahead, Mr. Kemp.
Yes, sir, I've got a question. At this facility here, do they plan on getting a sleep doctor, a vascular doctor, or a pain clinic here or anything in mind in the future?
I don't know that.
Okay.
Yeah, I don't know that. I don't know if anyone on my team knows that, but I'll look into it and find out.
Because when I have to go to Atlanta,
Yeah.
fight the traffic and all that, it's 2-hour drive. 2
Yeah.
hours.
Yeah.
and
sleep pain, and
vascular
yeah.
and,
I don't know that
pain.
answer, but I'll look. Yeah. It might be no.
One question right here too, Greg.
Are there travel reimbursements for community care?
Yes.
How do you obtain it? Okay.
Our experts can help. Yes. Go ahead, sir.
Yeah, I just wanted to find out, where can you get a hold of somebody through the system to find out what rules might be when you're trying to file like a supplemental on a claim? I basically have a condition where I have a bilateral condition, but it's not listed as bilateral. And I don't know if it qualifies. I have an appointment with my VSO, but that's not till the middle of next month because theirs backed up as the VA is. And I just wanted to know, because I did make a call today. I called the benefits office, and the young lady was very helpful, but she didn't have an answer on the rules. So how do you find out if you have a condition, if it's supposed to be? Because basically I have one knee affected, the other knee, which is a residual. So as I understand it, I have left and right, so it's bilateral, and it's not listed as bilateral, and it's a big difference on my compensation.
Yeah, great question. Lots of veterans have that bilateral challenge, and I see my team here. They've got somebody in the building that'll help you today for that, right?
The way we could determine that, if you can make an appointment with us and we can actually look at your file, we can actually see if that bilateral factor is recorded for your condition. And if it's not, we can tell you exactly how to get that and have us relook it so that it can be added.
And you'd be able to tell me if it qualifies or not?
If it's service connected, we definitely can look at it. And if it's not service connected, we can help you with that as well. Okay.
Wonderful.
I have a question about bills. A couple of months ago, I cut my leg. I had to go to the emergency room. They put 7 stitches. And I had to go back 5 days later. They took the stitches out, but they sent me a bill.
Okay.
Saying that it wasn't covered under emergency.
Work with our community care team in the back for that one. We do have a 72-hour rule to let us know so that we can provide that coverage for you. And then there's some options outside of that, but they can work with you on your specifics for that. Yeah. Mr. Kendall, right here, the gentleman in the white jacket.
About the Campbell and June water contamination. They're not doing anything now except setting it on the butt.
I don't know that. Do you know anything? You know,
Good question.
I'm looking at my VBA. Yeah, that's a great question.
I'm suffering from about 4 different things, and I was there.
I don't have enough power and authority to give you that answer as the director in Atlanta. Yeah.
We have another question here about an HSA grant.
The HISA grants. Is there someone here with the HISA grants? I've had 17 surgeries on my legs, both knees replaced, one revised. I put in for a HISA grant to have my toilets raised because going down too low is really hard, and they denied it.
The well-dressed gentleman right behind you can assist with that. Great question.
Hi. Okay. Oh, okay. How you doing?
Good. How are you?
Question. What is your policy at the VA hospital for a single veteran that has to get surgery? Now, let me tell you why I'm asking you that.
Yeah.
Because I've been told a bunch of different answers. One answer that was direct was that you can't have the surgery if you're single because you don't have somebody there to drive you home. Now, I've already coordinated with the doctor like several times. We actually done 2 virtuals. The surgery is what they call an outpatient surgery, meaning, it's minor and you're going to be released that day. In the past, I know you said not to get deep into your medical stuff. So in the past, I've had a procedure. I'll use that word. I've had a procedure done. And the policy was pretty much the same. I'm using the word policy because I'm assuming that's what it is. But the nurse, the head nurse there at that time of that division, that head nurse told me that after the procedure was done, we'll have you stick around for about 45 minutes. Then you'll come back, we'll evaluate you. I mean, you stay there at the hospital. We'll evaluate you, make sure you're okay, and you can drive yourself home. Now, I got an upcoming surgery. That's the reason why I'm asking you this. Because what I want to know is, what is y'all policy on that? As far as for a single veteran, okay, I don't have family here because I'm not originally from Georgia. Of course, I live here, but I'm not from Georgia. How am I supposed to get the surgery done and be able to take myself home that day?
So we do not have a policy that says if you're married or single, you can or cannot get surgery. The only directive guidance that we would have would be the safety of the veteran after the surgery. And that's going to be on a case by case, depending upon what that surgery might be. So I think it sounds like, though, we need to get a second conversation going with you on what that surgery is going to look like in a couple of weeks to get into the specifics. We just we have an acting chief of surgery that's pretty good. Let's engage some of our clinicians in the room in this conversation, and then we'll work through that with you. Yeah.
Yeah, because my surgery is coming up next month, so I need to know.
Yeah.
Also, we can work with Mr. Dumas. He's the chief of HAS. He might be able to work with you. Yes, sir. And find you some transportation as well. So we can help you coordinate that.
Yeah.
We'll have to coordinate that based on what your doctor says for your sake.
Here comes my nurse exec. This is our chief nurse of all the nurses in the hospital, so she might be able to support. Did you hear the question? Perfect.
Good afternoon. I'm Dr. Connie Hampton, and I'm the nurse executive for the Atlanta VA Healthcare Systems. So we'll need to see what type of procedure, it depends on whether you need someone to drive you home or not. So what happens is certain drugs do not wear off quick enough, and so you will need someone. So I think it's important for us to know exactly what you're going to have done. The reality is, I strongly suggest if you have any procedure done that you take somebody with you so you have them to drive, because you don't know exactly how that drug will affect you. So if you don't mind, I'll talk to you. We can figure out what procedure you're going to have. And more than likely, you will need someone to drive you. Or like Dr. Lee was saying, in the event that we need to plan ahead of time to get someone to drive you home. But I strongly suggest that you have someone with you, because that anesthesia, we just don't know. And it could be something simple that could have been why they allowed you to go home the last time. Something quick, there's different types of anesthesia. So yeah, if you want to have a conversation, I'll talk to you over here on the side. Do you mind? All right. Absolutely. Thank you.
My savior. I feel the room's energy changing and shifting, so let's get some stuff done. So maybe we'll do one more question, and then I'll let you guys go.
We had a question in the back about the discrepancy between when the email notification says your prescription is coming versus how long it actually takes. So the email might say 7 to 10 days, but you're really waiting 3 weeks. Is VA aware, and what are we doing with the interim? Like, when should the medication really be coming? How do you know it's really coming?
I've never heard that one. So whoever got that, give us some specifics so we can look into it. Because, we'll take that one back. I've never heard that one. Yeah, thanks. All right, let me thank everyone for coming. I really appreciate y'all's feedback. If you didn't give it to us in here, please give it to staff so that we can track it down. And I hope you have a good, safe drive home. Thanks.